Hello and welcome. Today we're diving deep into age-related macular degeneration, or AMD, a leading cause of vision loss in older adults. Understanding AMD is crucial for early detection, management, and preserving your precious sight. So, what causes AMD? The exact cause remains a mystery, but it's a complex interplay of factors. Age is the biggest risk factor, hence the name. Genetics play a significant role. If you have a family history of AMD, your risk is higher. Environmental factors like smoking and prolonged exposure to sunlight are also implicated. Poor diet, especially lacking in essential nutrients, can contribute as well. Now, let's look at what's happening inside the eye. AMD primarily affects the macula, the central part of the retina responsible for sharp, central vision needed for tasks like reading and driving. In AMD, the macula becomes damaged and thins over time. This damage can occur in two main ways, either through the build-up of yellowish deposits called drusen under the retina, or through the growth of abnormal blood vessels that leak fluid and blood, further damaging the macula. AMD is a widespread problem. It affects millions worldwide, with prevalence increasing significantly with age. It is one of the leading causes of vision loss and blindness in people over the age of 60, with a higher prevalence observed in developed countries and in individuals with European ancestry. How do you know if you might have AMD? The early stages may not have noticeable symptoms. However, as AMD progresses, you might experience blurry or distorted central vision. Straight lines may appear wavy. You might have difficulty seeing details, such as recognizing faces or reading small print. Some people notice a blurry spot in the center of their vision. These symptoms can vary depending on the type and severity of AMD. Diagnosing AMD typically involves a comprehensive eye exam by an ophthalmologist. This includes a visual acuity test to check your sharpness of vision, a dilated eye exam to examine the retina and macula, and optical coherence tomography, or OCT, a non-invasive imaging technique that provides detailed cross-sectional images of the retina. Fluorescein angiography, which involves injecting dye into the bloodstream to visualize blood vessels in the retina, may be used in some cases to detect abnormal blood vessel growth. AMD is broadly classified into two main: dry AMD and wet AMD. Dry AMD is the more common form, accounting for about 80–90% of cases. It's characterized by the presence of drusen and gradual thinning of the macula. Wet AMD, while less common, is more aggressive. It involves the growth of abnormal blood vessels under the retina which leak fluid and blood, causing rapid vision loss. Unfortunately, there's no cure for AMD, but there are treatments that can slow its progression and help preserve vision. For dry AMD, management focuses on lifestyle modifications such as quitting smoking, maintaining a healthy diet rich in antioxidants and omega-3 fatty acids, and taking specific vitamin supplements, known as RRDS2 formulas, that have been shown to slow progression in some individuals. For wet AMD, treatments include anti-VEGF injections, which block the growth of abnormal blood vessels, photodynamic therapy, and laser photocoagulation in selected cases. Regular monitoring is essential to detect and manage progression promptly. While we can't completely eliminate the risk of AMD, we can take steps to lower it. Protecting your eyes from the sun by wearing sunglasses, quitting smoking, eating a healthy diet rich in fruits, vegetables, and omega-3 fatty acids, and maintaining a healthy weight are all important preventive measures. Regular eye exams are also crucial for early detection and management. The prognosis for AMD varies depending on the type and severity of the disease. Dry AMD typically progresses slowly but can eventually lead to significant vision loss. Wet AMD progresses more rapidly and can cause severe vision loss if left untreated. However, with timely diagnosis and treatment, many people with wet AMD can maintain functional vision. Recent research is exploring new treatments for both dry and wet AMD, including gene therapy, stem cell therapy, and new drug delivery systems. These advancements offer hope for even better vision outcomes in the future.